for the BHAB. I'm just an update. I'll be filling in for Michael in the beginning of the meeting, and he'll be on virtually, and we'll be taking over a few minutes in. So I just want to give you guys that update. So I'd like to call to order the meeting and move on to item number 2, the board member roll call. Janice, would you be able to?
Yes.
Thank you.
Second, please. Claudia Armand.
Here.
Soledad Barragan.
Here.
Here. Nancy Borchard. Here. Jane Brooking. Jane here. Okay. Kevin Clarisi. Genevieve Flores Haro. It takes a few minutes to, reply, I know, so, no, okay. Commander James Fryhoff is appointee. Myself here. Cheryl Heitman.
Here, sorry.
Okay, CJ Keaveney. Supervisor Lavere. We're not hearing the.
Hi, I'm here. Sorry, I was muted.
That's okay, no problem. And I see Kevin just joined us. Great. Hi, Kevin. All right, know me. Yay. Jennifer Morrison. She's here. You're under Jen. Yeah.
Right here.
Okay. Patricia Malabi. See you. Elizabeth Stone is here. Present. Krista Hayda.
Here.
And Marlon Torres will be joining us in a few minutes. She's not here yet, though. She did. Oh, CJ just joined. Thank you. Great. All right. So, all right, Marlon, Liz Warren. Okay. Diane McKay. Is
I wasn't unmuted. They didn't unmute me right away. Hi, good afternoon.
Hi, thank you, Liz. Diane McKay is our new member, but she will be here next month. She had a meeting change. She had she couldn't change. Okay, so it looks like we do have a quorum, so we can proceed.
Thank you, Janice.
Thank you.
Okay, so moving on to item 3, welcome and introductions. Hi, everyone. My name is Chris. I'm the first vice chair of the 4th district under Supervisor Parvin. I'm the co-chair of the Adult Services Committee and consumer and advocate. So thank you. And I'll turn it over to Janice. And oh, sorry. Oh, sorry. Thank you.
Hello.
Hello, Lorena.
Can you hear me? Hello, good afternoon. This is Lorena and Ariana, and we will be providing the simultaneous interpretation services for the meeting today. And sorry. You can access interpretation services by clicking the globe icon in the bottom of your Zoom screen and then selecting either English or Spanish. We do ask that when speaking to please be mindful of our simultaneous interpretation, to speak slowly and clearly, and to try to avoid interrupting or speaking over one another. We will signal you with the raise hand symbol on Zoom if you're speaking too fast and need to slow down. We will signal you by turning on our camera if you need to speak and enunciate clearly. And please pin us on Zoom so that you can identify us as your interpreters. Thank you for keeping the interpretation services in mind while conducting and participating in the meeting. Your assistance is very much appreciated. Now, Ariana will say this in Spanish.
Muy buenos días y gracias por asistir a la reunión. Ariana
es mi nombre y Lorena vamos a estar interpretando toda la reunión. Podrán acceder a los servicios de interpretación al cliquear el icono del mundo que tienen en la parte inferior derecha de sus pantallas y seleccionando el idioma que quieren escuchar. Vamos a señalizar levantando la mano cuando se hable demasiado rápido y necesitemos como intérpretes que hablen un poco más lento, y vamos a también señalizar prendiendo nuestra cámara cuando necesitemos que enuncien las palabras claramente para que podamos también dar el mejor servicio de interpretación. Por favor, sean conscientes de la velocidad y de la enunciación a la hora de hablar, y les agradecemos mucho por esta oportunidad de participar en la reunión. Muchas gracias. If you can already assign us as interpreters, we would be more than glad to do so.
Ariana, perdón, no me aparece, ya, perdón, ya apareció, gracias.
Okay, thank you. Thank you, Lorena and Ariana. Appreciate it. So moving on to welcome and introductions. To introduce myself, Janice, would you please introduce yourself?
Sure, Janice Gardner, and I am the chair of the Prevention Committee, board officer as secretary of the BHAB, and I'm from Supervisor Long's district.
Thank you. Janice, would
Oh,
you
do
be
you
able
want me
read
to call them?
through the?
Okay, yeah,
that'd be good.
okay, Claudia,
Claudia Arman, District 1, BHAB member and family member.
okay, Soledad Barragán, did she join us? Okay,
Hola, soy Soledad Barragán. Represento el Distrito 5 y representando la comunidad.
thank you. Nancy?
I'm Nancy Borchard, and I am served on District 3. I'm a family member and member of the Adult Committee, as well as second VP.
Thank you. Did Gain Booking join us? If not, Kevin Clarisi.
Yeah, good afternoon, Kevin Clarisi. I'm with District 1. And I chair the Youth and Family Committee. Happy to be here.
Genevieve Flores Hara.
She's not
Still not, okay, all right. Myself, I heard you, Cheryl Heitman.
Hi, good afternoon. I'm representing District 1 and a member of the Youth and Family Subcommittee.
Okay, CJ Keepney.
Good afternoon. I'm CJ Keedney, District 2, appointed by Supervisor Parks, and I'm a member of the TAY Committee.
All right, Supervisor Lavere.
Everyone, Matt Lavere representing the Board of Supervisors.
Thank you. Nomi Marufa.
Nomi Marufa, appointed by Kelly Dawn, District 3. And I also work with Spirit and Home.
Good. Okay, Jennifer Morrison.
Hi, District 4, Janice Parvin, Advocate, Adult Services Committee. Thank you.
Patricia Bobby.
Hi, Patricia Malavi, District 2, Prevention Committee.
Elizabeth Stone.
Good afternoon. My name is Elizabeth Stone. I was appointed by Supervisor Parks. I identify as a person who's, among other things, as a person who's been diagnosed, was hospitalized, and made several suicide attempts. I've worked in the behavioral health field for over 20 years in a variety of capacities, and I currently chair the TAY Committee as well as serve on the Suicide Prevention Council. Thank you.
Chris Tejeda.
Hi, I'm Chris Tejeda. I'm the first vice chair of the 4th district under Supervisor Parvin, consumer and advocate. Thank you.
Did Marlene join yet? Yes. Okay, Marlene Torres,
Hi, good afternoon. A District 5 and Chair of the Reducing Disparities Committee.
Liz Warren,
Hi, good afternoon. I'm Liz Warren, the Executive Director of the Client Network. I've been a consumer advocate for 15 years and a VCBH client for 21 years. And I sit on the Adult Services Committee, the Prevention Committee, and QMAC, and I represent District 5. Thank you.
and is Michael Chair Rodriguez here? Can you join us yet?
Yes, I'm joined in.
Okay, all right. There you go.
Thank you, Janice. Okay, so moving on to item 4, the approval of the agenda. And as an action item, I hope everybody's had a chance to review it. And could I ask for a motion and a second?
I'll move approval of the agenda as written.
I'll
Thank you.
second.
Okay, so I have Elizabeth Stone made the motion and then Janice Gardner for a second. Thank you. Is there any discussion regarding the agenda? Yeah. Seeing no hands raised, I'd also like to ask for public comment because it's an action item. Seeing no hands raised, Janice, could you have?
Sure.
Thank you.
Sure. Claudia Armand,
Yes.
Soledad Barragan, you approve?
Yes.
Nancy Borchard,
Yes.
Kevin Clarisi,
Yes.
myself, yes. Cheryl Heitman,
Yes.
CJ Keaveney,
Yes.
Supervisor Lavere,
Yes.
Naomi Marufo,
Yes.
Jennifer Morrison,
Yes.
Patricia Malabi,
Yes.
Elizabeth Stone,
Yes.
Krista Hayda,
Yes.
Marlon Torres,
Yes.
Liz Warren.
Yes.
Okay, approved as written. The
Thank
motion
you.
is approved as written.
Thank you, Janice.
Agenda is written.
Okay, so moving on to item 5, we have approval of the January 23rd, 2023 minutes. And as
This is Matt. I would move approval.
Second. Cheryl.
Did we lose Chris?
Looks like it.
Okay. Yeah.
are you able to hear us now?
We can hear you. We can't see you, Chris.
Okay. Thank you. I think we're working on it on this end, so we'll just take a minute. Oh, perfect. All right, so everybody could see us and hear us?
Yes.
Yes.
Great, thank you. Okay, so we were just on item 5, the approval of the minutes. I believe we had Supervisor Lavere make the motion and Cheryl Heitman make the second.
Yes.
Could I please ask for, are there any revisions to the minutes? Okay, seeing no hands raised, as it's an action item, is there any public comment related to the minutes from January? Okay, seeing no hands raised, Janice, could you
Yes.
please?
My pleasure. Claudia Armand,
Yes.
Soledad Barragan,
Yes.
Nancy Borchard,
Yes.
Kevin Clarisi,
Yes.
myself, yes. Cheryl Heitman,
Yes.
CJ Keaveney,
Yes.
Supervisor Lavere,
Yes.
Naomi Marufo.
Yes.
Jennifer Morrison,
Yes.
Patricia Malabi,
Yes.
Elizabeth Stone,
Abstain.
okay, Chris Tejeda,
Yes.
Marlene Torres,
Yes.
Liz Warren.
Abstain.
All right, we still have a quorum to approve January 23rd, 2023 minutes.
Thank you, Janice. So moving on to item 6, the Brown Act new normal discussion. So
I can jump in
oh,
on that.
thank you.
Yes, so we just wanted, Michael and I were talking over the last month, and as you recall, we are the messengers of the new law that will be going into effect, effective in March 1st. And you recall that we are on a, we have an emergency declaration by the governor that will be rolled back. And so the new Brown Act rules will have to be followed. And again, that's beginning March 1st, unless for some reason the emergency order is not rescinded, and we have every reason to believe that it will be. So those of you that are involved with subcommittees, this will apply to subcommittees as well as the full BHAB. And again, starting next month, just a reminder that that we have to have a physical quorum present to do business. And if there's not a physical quorum present, then we really can't go on at that point, because to go on would be the next thing that we have to do is have motions on whether we're going to accept people, you know, for just cause or for an emergency. And we have to actually vote on if the board approves the emergency. So it will become old hat after a few months. But the first couple of meetings, I'm sure we're going to be a little bumpy, and we'll figure it out as we go. Jason Kanger typically is around county council, you know, to help us work through any rough spots. I think the big thing, as a courtesy to your fellow board members, if you know that you are not going to be able to be here by Friday, let Jackie know. Because if we know that we're not going to have a quorum, we can let all the board members know, and then those of you that were planning on driving in wouldn't have to make an unnecessary trip. So it's really not required that you let us know by Friday afternoon if you're going to make it for the Monday meeting. There's no requirement of that, but it's just, we're just putting that out there as a best practice for each other. So once we start the meetings next month, we'll determine that there's a physical quorum, and if there is, then we have to move on to everybody that has a just cause. Then they would actually have to state for the record that they've requested a just cause attendance through video conference. And again, anybody over the age of 18 that's going to be in the room with them, participating in the room, we ask that they name that person. Emergency circumstances can be, the request for video participation can happen right up to the beginning of the meeting, but emergency circumstances has to be put on the agenda and voted on by the board. And so we'll have the cheat sheets out for you again. Like I said, we'll walk through it a few times, and hopefully it'll become old hat when we get down the road a little bit.
So if we're not meeting, how do we vote on whether we accept the exception?
You wouldn't be able to.
That
Yeah,
just wouldn't happen.
yeah. If you don't have a physical quorum in this room, we're done. It's not up. Yeah, yeah. Now there's discussion on whether, you know, some boards like to continue to, you know, have discussions and things like that. It's really considered best practice not to go on out of respect for the members that aren't there. Or if, for example, if you have people from somebody that was making a presentation or something. I've been in meetings sometimes where they say, oh, let's go ahead and do the presentation anyway. And it's really considered best practice to, if you're going to do business, you have a quorum. And some of that is out of respect for the other board members, but also out of respect for the people that are doing presentations, so that they have the attention of the full board, or at least a quorum of the board. So, but again, those will be things that this commission will have to work out what the norms are going to be as we go. I see some hands.
So first hand is Liz Warren.
Oh, I believe Carol was ahead of me.
Yes, and Janice is after me. Thank you, Scott, for sharing the information. I have a two-parter. First part, I've had quite a few health issues lately, and I start out Friday, okay, by Saturday or Sunday morning, I'm flat on my back. How do you know in that case like that? To give an advance notice that you won't be able to attend. And so I'll give you a chance to answer that.
Carol, I'm going to repeat your question so I make sure I understand. You may have a health request for a physical or medical emergency, but you might not know in advance. Was that your question?
Yes.
Yeah, there's no requirement that you let us know before Friday. You can make that request all the way up to the beginning of the meeting. But if you know that you're going to be requesting it, then it just helps us with determining whether there's a quorum or not. So you just basically do the best that you can do. And if you are sure, then you want to make sure and let us know. But understand the whole purpose of the emergency exemption is that it is an emergency. You know, you won't know. You may not know until the weekend or you know, Sunday afternoon, those sorts of things.
All right, thank you. Part two. What would be the possibility of sometimes dividing up the locale of the meeting? A lot of us are in the East County, and I'm just wondering what would be the possibility of maybe once a quarter or maybe twice a year, some kind of formula, so that people who have to drive 20, 30 miles would have some mediation for their drive time.
Sure. I mean, I think I would recommend that we bounce that to the executive committee, as long as following the Brown Act with posting the meetings and posting the location and have the appropriate video and teleconferencing equipment in place. The meeting can be held in other locations. But it would really be up to the commission to figure out where they wanted to do that. And then, you know, staff, we can make sure that we follow all the Brown Act things behind the scenes.
Thank you.
My next. Yes, okay, so I just wanted to confirm that not only is the in-person requirement for BHAB members, but we also have community members and stakeholders and providers that say that, you know, we agreed many years ago that they are also members if they come on a regular basis. So do they also have to meet in person?
The Brown Act only covers voting officially appointed members by the Board of Supervisors. So staff, providers, members of the public are always welcome to attend through Zoom.
Okay, but we've been told, and they have been told that they are actual members of the committee, but since they're not approved by the Board of Supervisors, are they really not members of the committee then?
Or you're talking about subcommittees.
Yes.
I am going to have to defer that to county counsel, who's on the phone, and I'm not sure if, Jason, if you're able to answer that question now, or if you would like us to report back.
No, sure. If they are members of a standing committee of this commission, then they have to participate in person.
Okay, all right. We'll have to let everyone know
Subcommittees, yeah.
during our next subcommittee that if they've been attending on a regular basis, which makes them members, assuming they want to be members, then they have to appear in person as well. So, okay. That's my question. Thank you.
Thank you. I'll just jump up to Liz Warren and then followed by Nancy.
Thanks, Chris. Well, Janice asked the first part of my question, so thank you, Janice and Jason, for clarifying that. The other quick question I have, since we're going to still be in a hybrid model, as a board member, if I want to join in on a subcommittee that I'm not on, can I do that virtually? I don't have to be there in person if I'm not a voting member, even though I'm a board member, correct?
Interesting.
That's correct.
Thank you.
Thank you. Nancy.
Okay, I guess I'm confused. I just had a comment, but if we're all in person, we're in hybrid, or are we still in hybrid?
We're still in hybrid.
Okay.
Yeah.
So just requirements.
Yeah.
Change.
For
I just had a suggestion that even if people, as in CJ's case, she may not know until Monday morning, like, I just can't do this. it would really, to let Jackie know, she could send an email to all of us. At least we could check it before we drove in, you know, that would be, I think if we all tried to do that at the very least, certainly earlier is better.
Yeah.
And there's not always an opportunity for everybody to check their email, but that'd be easier to check your email than drive from Cameron or Thousand Oaks to
Yeah.
here and then go, oh, rats.
Yeah.
So in other words, if we had multiple emails, or like, oh, there's no.
Well,
Jackie,
or
that's-
even, that's well, I guess that's right, because we don't know how much that would be.
I think as a general practice, if you could all let us know by Friday afternoon, and then if something happens over the weekend and Monday, we will make heroic efforts to stop you from driving, you know, even if we just have to split up and everybody make a phone call, you know, it's not that, it wouldn't be that big of a deal. Yeah, yeah.
Thank you. Elizabeth?
Yeah, I have a couple of questions, and this is actually kind of one of those things when my values collide.
Mm.
You know, it concerns me that people that may not be able to make it for whatever reasons, would then preclude the committee from meeting and us conducting, I hate that term, conducting business, but moving forward with things that we're trying to address. So on one hand, I'm obviously a big advocate of accommodations and supporting what people are comfortable and capable of doing. On the other hand, I personally always feel a responsibility to the various communities in the county. For the kinds of conversations and sharing that takes place here. So kind of my gut reaction is I'm very concerned that people that have now, and I'm saying this as an observation, not necessarily as a judgment, people that have become accustomed to the ease of logging into a meeting rather than making the commitment to make a physical trip. Because I noticed my own behavior being very different when I was on camera among whatever I was in whatever setting versus having to come here and make a commitment and behave in a kind of different personally accountable way. So I just, and the committee that I chair currently, the TAPE committee, consistently has problems with quorum, but we continue to meet just because for the people that are present, we're doing information sharing and some different things. There is a recording, there's a record, so some tasks are being conducted. And I hear you say that it's best practice not to continue. So maybe part of what I'm considering is asking people to think about, as much as they value their participation on the BHAB, consider whether they're able to make a consistent commitment to coming here physically. Because now it's going to be different again, right? It's different to come here. And of course, there's a lot of benefits that we get to interact before and after, and there's just different kinds of things. So I see a lot of perspectives on that, but it also kind of raises some concerns for me. So thank you for letting me share that perspective. But the second thing I would also like to ask then is address this very briefly, and you were my into this, Scott. If now the since the subcommittees and I trimmed the quorum, the membership for my committee so that we can meet a quorum. But if the subcommittees are now going to return to monthly meetings rather than bi-monthly meetings, and kind of what was the decision? We understand that still in order to conduct business, people need to be physically present for the quorum, and that there will still be hybrid options for greater participation, but I'm just wondering about the frequency.
We'll have difficulty getting staff there for minutes if all the committees go back to monthly. That said, it's the chair's discretion. So if you all decide you're all going back to monthly, we're going to have to scramble and try to figure something out because we wouldn't have enough staffing coverage, you know.
Because I think what we had been doing, as somebody had mentioned, was depending on the specialization of the subcommittee, somebody kind of got pulled in and Yeah, but,
Yeah.
so it's kind of,
Chair's
but
just-
it remains an evolving.
Yeah,
Okay, then,
Thank you.
yes,
Oh, Nancy.
I just wondered, what was the motivation behind this big change?
well,
Was there
this
a
all
previous
came out of
problem?
Assembly Bill 2449.
Right.
I'm the mere messenger.
No, I know that. I just thought maybe you had.
Honestly,
heard
yes,
discussion on
it is a step forward. Believe it or not. The emergency order was extreme. But in the old days, if we wanted to have somebody participate remotely, we would have had to post your living room. And you would have had to open up your living room to any public member that wanted to attend. So we really didn't have a way to do good remote participation in the old days. Pandemic happened, we all got used to the new normal, but it's not the new normal anymore. And the legislature said, all right, well, we're gonna loosen up the Brown Act a little bit and give you this new option, but it's only in these circumstances, which are very prescribed, and it's only 2 times a year. For this board. County council and I talked about committees. Committees have a separate total, so your 2 per year is 2 for this meeting,
Oh,
but committees
each-
can be 2 as well.
Okay.
So it doesn't count.
Yeah, that would really be.
But yeah, so it is from the old days, it is a step forward. But it feels like a big step back, because of
Well,
the
I just-
emergency
I
flexibilities.
just wondered if there was some event or some kind of thing that happened that made people go like, gosh, we need to change that.
Yeah.
Be more in control or more open and more publicly, everyone is speaking in front of.
Yeah.
I agree with Liz. Some great.
Liz? Warren?
Yeah, I just wanted to quickly clarify that Governor Newsom put in the March 1st date, and the Board of Supervisors took a look at it. 4 of them agreed to open up again on March 1st. 1 supervisor voted no and wanted to go with the date established by President Biden. So just FYI, this decision was finalized and approved by the Board of Supervisors. Thank you.
Thank you, Liz. All right, and before we move on, I wanted to jump in here and say we'll be having an adult services meeting this Thursday, and that will be before we meet as a general board meeting. So we won't have a chance yet to define the just cause exceptions and those rules. So please, if you're on the adult services committee and are able to make it, please make it in person. And if you're not able to make it, then please provide an email to Jackie. That would be great. And Jackie, did you have?
Yes, I also did send the Brown Act out to the Adult Services Subcommittee, so they can take a look at that email as well to check again, which is.
Oh, thank you. Thank you. And did everybody on the call hear Jackie as well? Was that? Oh, okay, great. Just want to make sure. Okay, great. So moving on to item number 7, public comments. Are there any public comments at this time? Okay. Alrighty, seeing no hands raised, we'll move on to item 8, which is chair comments. Is Chair Rodriguez? Okay, sounds good. So we'll go ahead and table item 8 until later in the meeting when he joins, or for the next meeting. So moving on to item 9, director's report. Director Gilman.
Sure. I'll just make a couple of comments about my actual written board report, and then at the end, I'm going to ask Dr. Shipper to jump in with some exciting news that we have about some funding availabilities. So specific to my report, I do want to announce that in cooperation with Oasis Healthcare and many mansions, an application was sent in for funding through the California Infrastructure Plan, or we call it BCHIP, for $19.75 million to help finance the 120-bed facility out on Lewis Road. And so hopefully, thanks to the work of many people, many of you on this call submitted letters of support which we greatly appreciate. We have all of our fingers crossed that this will go forward. If for some reason we don't get this grant, we desperately need this facility to move forward, and we'll be having more discussions about Plan B, as we go for financing that. I also wanted to let you know, in my report, I talked about the draft of the community feedback for the MHSA plan that has been posted on the MHSA plan for additional comments and feedback if you want to review that. And just a reminder, you won't see your comments in there verbatim. We have this balancing act between getting things in there and keeping it specific but vague enough that we can do the sorts of projects that you want to do over the next years. So just a heads up about that. I also wanted to let you know, in the back of my report, you'll see a new addition, the out of county placements. Some had requested that, so we're going to put that data in there quarterly. We don't have a press the button quick way to pull that data, so Dr. Schiffer and his team will be providing that to us every quarter. So you'll see we still maintain quite a few folks out of county. Another reason why we'd like to get more facilities built, in town. The other thing in my report that's new is some trend data, and you'll see trend data.
Trend.
Yep, and I'll just kind of hold this up so you can all see what I'm talking about. I like data, but I don't like data that's just you can't really use it, for predicting. And so you'll see on page 1 of 4 in the data part of it, where we've put fiscal year 2021 compared to fiscal year 2022 compared to fiscal year 2023. So you can see year after year where we're at with total active consumers in our system. And so if you add 9 plus 15, we're 14% higher, as we go. That helps us with forecasting. It helps us with budgeting. And it also helps us with looking at common trends. Like you can see already, we can see there's always a trend, a little bump that we get every March for some reason. So it'll help us, as we go forward. So we'll continue to massage this, make it more user-friendly. And if there's things that you'd like to see included or added as we go, this report really is for you. We're now sharing it with the community and with staff. So we want to make sure that if there's things in there that we're not grabbing, that we do our best to get it in there. And so with that, I will take some questions, and then I want to jump to funding. Yeah, or any questions, I'm sorry.
And I just wanted to, I see Michael Rodriguez has joined the call. So Michael, if you feel comfortable, if you would like to take over as chair.
Sure, thank you. Thank you, Chris.
So we're to the questions part of my report, and I see there's one hand up in the room here, Michael.
All right, and go ahead, whoever that is. I can't see.
It's me, Michael.
Okay.
Hi. Welcome, glad you're back here.
Thank you.
A couple of definition questions. Scott. How do you define an active consumer?
We have billed for one service.
One service.
Yep, that means they've gotten through the front door, they're in, and we've actually billed.
So is that the intake and assessment, or is that actual meeting with a psychiatrist or a therapist, or like what is there any way to clarify what that means?
Yeah, it's if there was an intake assessment that was billed, then that
That's
counts.
the one service.
Yeah. Yeah.
So it's possible. See, this is where it gets, I don't like this kind of data.
Well,
because it's too conflated, right? So a lot of people do an intake and then the wait is too long and they drop off and then they're in the emergency room 6 months later, right? So, I appreciate this.
Yep.
And I know it's also kind of politically, we need to see like, oh, well, there's much of greater demand, please support, blah, 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 blah. But this is, for me personally, why the nuance of data is really, really important.
Yeah.
Like what's happening to people, is this people that are continuing in services and there's like additional people, are things changing? Like it's helpful to some degree, but it also kind of camouflages the things that actually help make decisions, right?
All
in
of,
my perspective.
absolutely, you're exactly right. And all of that data is available to drill down. And so like even down to the level of care. And we had extensive debate about this when we rolled out the data dashboard.
Right, exactly.
So
Yeah.
the key is that when we put data like on the data dashboard, we'll have very specific descriptions of is it a paid claim or is it a billed service? Because there's
Right.
also a gap there,
Yeah.
you know, as we go. So yeah, this is a mere snapshot of, you know, what's happening at the front door. How many people actually make it into, you know, 6 months of care or 8 months of care, or, you know, all of that stuff. Those are all different kinds of reports.
So do you have a sense if this is the majority of people are continuing and there are additional people?
Yep, we have.
Or because some people, my understanding, again, I'm still trying to get a grasp of this.
Mhm.
They may meet with a case manager once every 6 months, but they're on
Yep.
books.
And that would,
Right,
that's
so-
always been true.
Yeah, yeah.
Yeah. And we have folks that would be what I would call meds only people, for
Right.
example. But that's always been the case.
Yeah.
Yep. What we have to look at are those specific, you know, do specific performance improvement projects where we look at how many people, you know, made it from the phone call into care, how many people dropped out after 3 months, how many people, you know, all of those types of things.
So how current's the data on the dashboard? That's the QMAC dashboard, right? Or,
The dashboard hasn't been published. It's not up yet,
oh.
but that's the
okay,
one that
the
you all
discussions
reviewed.
That we're still having, okay.
But
So
that
it
will be,
available.
that will be very current.
Okay, thank you.
Any other questions for me or my report? All right, well, I'm going to introduce Dr. Shipper. Many of you know, we're going to review a funding opportunity that we have and just want to make sure everybody's on the same page with that, with some MHSA funding. So could we unmute Dr. Shipper? Thank you. All right, John, if you would like to proceed.
All right, can you hear me okay?
Yes.
Yes.
All right. And Jackie, are you able to go to vcbh.org? I'm just thinking it might be easier for people to see it in real time, sort of how you can find access to this funding opportunity. But basically, there's a notice there around mini grants.
Yeah.
While Jackie is pulling that up, I do want to let you get just a return to our big picture vision of where we have to go. And I use this analogy all the time, the three-legged stool. One leg of the stool is we're an insurance company and we have to build that leg out and really start walking and talking and squawking like a regulated insurance company as we go into Cal-Aim. The other leg of the stool is what's the role of government in providing treatment services? Which things should we do? You know, when we're, you know, for example, taking people's rights away in all of our direct service programs. And then the other leg of the stool is our responsibility as the insurance company is to make sure we have a really robust system of care in the community of nonprofits and community treatment providers. So this opportunity was really looking at that third leg of, we really want to try to help our smaller organizations in the community and start to plant seeds and grow little baby nonprofits. Elizabeth brought up last time, it's not enough money really to do a startup. You're exactly right. It's not enough money to do a startup. But we will be issuing RFPs as we get further into the year for larger amounts of money. So with that, I'll stop talking about the three legs of the stool and go back to Dr. Shipper.
So just so excuse me, in terms of where to find this, maybe if you go back one step, Jackie, just so people can see it at the login page, it's found in the banner. And then clicking the banner is going to take you to this page. All right, well, be that as it may. So if you go to vcbh.org, you'll see the department's website. And then, like I said, there's an orange banner at the top of the page. There's an opportunity to click on Notice of Availability of Funding, and it'll bring you to this page. And probably most critical point of this page is not only the deadline, but then there's the go down just a little bit further, there is the application guidelines, which anybody who's interested will want to review the application guidelines. And just like Scott says, it is intended to basically sort of nurture and prompt new prospective contracts and programs and pilot opportunity. And it'll be MHSA funded. And again, with that, I'm not sure anybody else, if you have questions or.
Can you open the application guidelines?
He asked you to open the application guidelines, Jackie, I think.
There you go. So it's very consistent with what you find in most grant applications. It has various sections that are intended to hopefully ideally answer whatever questions might come. And then of course, if there are additional questions, depending upon the nature of the questions, you can query either MHSA or Marissa Seal, who's our contracts manager. You can see as it appears on the screen, her email address is there as well.
You see these are mini grants up to a maximum of $30,000 per grant. And so we're looking at prevention, early intervention types of activities, which is it can be a fairly broad category. But the
total is only going to be 300,000. Is that correct?
30,000.
No, the total.
Oh, yes, yes.
300,000.
Correct.
So we're interested to see what it elicits and interested in finding new partners and looking forward to the process.
So thank you all for the feedback that we received. Some of the, a lot of the community feedback is written into this idea and into this application. But you'll see there are some things like less traditional. That's one of the things that we were hearing a lot in the community feedback session. So you'll see, for example, wellness sorts of activities like yoga, those sorts of things. So lots of good information in here. My request would be take a look at this and let organizations know that you know of that may be interested in applying for some of this funding. As we go forward, the other shot in the arm that we're working on that we don't have ready to go yet is how do we help our current contracted providers? This funding specifically is for organizations that we don't have contracts with, because we're looking at a different initiative, a more robust initiative for our current contracted providers. So that will be in phase 2.
I have a question. Jackie, would you mind going back up to the top? There was something here about a one-time, let's see. Okay. I don't know where it is, but it says something about doing a one-time $10,000. What I just read it.
Page 3. There you go.
Oh, yeah, right. There you go. Thank you very much. Dr. Shipper Director.
Sure. So these are just some examples of funding. And then some criteria. So if you want to do, like, for example, school districts like to do very large events, like a community, let's just brainstorm for a minute, a neighborhood wellness event, or a parent group in the community wants to work with schools and do a major sort of prevention event for their area. Those sorts of things will be limited to $10,000. But you can also apply for up to 30,000 total in the application. So there's other categories in there as well. So if you want to scroll down a little bit further, Jackie, you can see some of the other categories.
We'll check.
Yeah. So there you go.
Great. Okay. Good.
We struggle. Well, we don't struggle. We have to be good public stewards. So I think when you start talking about more than $30,000 for those, or more than $10,000 for those sorts of events, it gets a little hard to justify. So that's what we put that on.
Thank you. Thank you.
All right. Well,
Good
thank
news.
you. If you have questions, let us know. spread the word. I'm really excited about this for some of our smaller organizations that have approached us for money, have approached us wanting to support our community. And so this is a great way to get started. So thank you, Dr. Shipper and staff for making this happen.
Thank you. Bring it up.
Are there any other questions for Director Gilman? I don't see any online. Is there any in the room?
No.
All right.
Hello, this is James Espinoza. I'm sorry, I was trying to figure out how to raise my hand in here if I can ask a quick question.
Sure.
With my camera on. So, hello, James Espinoza. I'm a current active law enforcement officer, military veteran, and family member / suicide loss survivor. I currently run also a veteran nonprofit, and I applied for the IDEA money a couple years ago, I think. I forget what the program was called, but this is a great program. I've already notified Gold Coast Veterans Foundation. I wanted to know if I didn't see anything specifically on that grant, if it was open to veteran nonprofits or they're included under that, just the community umbrella of ideas. Obviously, if I do become a member of the board at some point, I would not accept or request monies based on any perceived conflict of interest. But to my question, is it open to veteran groups or is this specifically to other organizations?
Oh, absolutely. We would welcome veterans groups. Yes. So to answer your question specific, Mr. Espinola, yes, it is available.
Thank you.
There is on page 6 of the guidelines, there are the restrictions. There are not very many of them, and they're pretty straightforward. So if anybody has any other questions of that sort, go ahead and you can check the restrictions and see for yourselves.
Thank you. Are there any other questions? All right. So I believe, and I apologize for jumping in late. I was en route. So I believe we're on item 10, board member comments and announcements. Is that correct?
Yes.
Yes, and Director or Chair Rodriguez, we skipped over chair comments. We tabled those. So if you want to go back to touch on those.
Let's go to board member comments and then we'll loop back. So Jennifer Morrison, I see your hand up. And then let me, one moment, Jennifer. And then for those of you who are in the room, if you can let me know if there's any hands raised in there, so I make sure that we can talk with everybody.
Will do.
Good afternoon. I wanted to request that after the BHAB meeting, shortly thereafter, we could post the next date sooner than a week before the meeting. I think it's important for the public to be able to see the new date well in advance so that they can prepare if somebody wants to speak.
Sure. It's my understanding that the dates are already posted.
Yeah. No, I checked it about a week ago and it still said the January meeting.
Oh, you're talking, it's on the
agenda.
Right, but the public wouldn't exactly know to check an agenda from the previous month. So I think it's important for the general public to be able to see that information online.
I agree, as much transparency and notice as possible, but also at the last meeting, we did announce, so over a month ago, and it was in that today's meeting was going to happen today because of President's Day. But you know, we will post. I would like to have meeting notices posted as soon as possible, given.
Yeah, I mean, because the public, the population we're trying to address is the actual public. Like, if somebody wasn't at a previous meeting, they're having issues, they're instructed to go speak at a general meeting. If they pull up the website, they would have seen January 2023. So I think it's, if we already know what the date is, even if the agenda is not ready, perhaps we could just at least update the next meeting date on the website.
Yeah.
Okay.
Thank you. Thank you.
You're welcome. Are there any other board comments or questions, I suppose? I don't see any hands up electronically. Are there anybody raise hands in the room?
No.
No?
Sure enough.
All right. So let's move on to the secretary's report.
Thank you, Chair Rodriguez, and welcome back.
Thank you.
And thank you, Chris, for running the meeting. Okay, so February is National Black History Month. Wanted to mention that's important. And another thing that I think is important too is congratulations to Chair Michael Rodriguez and to Marlene Torres for their reappointments to the BHAB. We have still 2 openings for BHAB members in Supervisor Carvin's office. And as James mentioned, James Espinoza mentioned, he is one of the, or maybe he didn't mention, but I would like to mention that he's one of the candidates, and hopefully that he will be appointed. And if not, we welcome you to join any of our meetings at any time.
He's also a veteran, so.
Yes, I know. Yes, and they know. So anyway, we welcome you. Thank you for your service as well. Okay, I also wanted to mention that Diane McKay, who is not at this meeting, was appointed and approved by the Board of Supervisors, and she will be at the next meeting. She had a conflict for this date when it was changed. The MyComp yearly fundraiser, Tequila Rising, will take place on March 17th. And this time it's at a new location. It will begin at 5:30 at the Consulate of Mexico, 5151 West 5th Street in Oxnard. And all proceeds for this benefit will go to the Santa Barbara and Ventura County Takeo Scholarship Fund for Youth. Residents and dignitaries celebrated the opening of the Port Hueneme Teen Center, which is a collaboration between the city and Port Hueneme. Teens 13 to 18 can congregate at the center to receive educational career support, character and leadership development. And that is at the Oving Community Center, and it's open from Monday to Friday from 3 p.m. and 7 to 7 p.m. I also wanted to mention that we have Ventura County has their own wellness centers. And so I wanted to mention that as well, because this is a very important aspect for us here in the county, that, you know, people can get services and go to the wellness centers as well. Okay. Director Gilman last month mentioned a couple of MOUs that were approved by the Board of Supervisors. One for the Wellness Center Services funding. And from MHSSA, which is the Mental Health Student Services Act. And that was increased from 4.475 million to 5.613 million. And let's see, there's another one that was approved for California Mental Health Services. You know, I don't have that, but oh yeah, right. And that was for Cal Mesa, and that was not to exceed 77,463. So those were 2 MOUs. I'm sure there were others that were approved. Veteran lawman interim chief Steve Shorts will serve as the Simi Valley new chief of police. And we have heard, and it was in the newspapers also, that there are civil rights groups that are challenging Governor Newsom's new court program for people with severe mental illness. And they have filed a petition in the Supreme Court, but it is our understanding that we are continuing along.
Yeah, yes.
Would you mind commenting on that?
Sure. So there's, I read the most recent brief over the weekend. So the disability groups have filed a petition requesting an injunction on implementation of care courts as being unconstitutional, and a variety of other things, a lot of minutia, a lot of technical details. the state responded, and to all of the concerns. And then, just last, I think it was Thursday or Friday, the disability groups, filed another briefing and appealed to the Supreme Court at the same time, asking for an injunction. And, it revolves around things like your right to refuse medical treatment, those sorts of things. So both sides are making incredibly good arguments. This is not an easy topic, you know, and so it's in the hands of the court at this point.
State Supreme Court.
Yeah.
Thank you. And that's it for me for the secretary's report.
Thank you. Are there any questions for Janice? Any board member comments or public comments? All right, moving on to items 12A. So we're going into BHAB committee reports. So moving on to
Excuse me.
12.
I'm sorry,
Yes.
Chair Rodriguez, did you want to back up and do your report?
Sure. I'm going to be super brief. This last weekend, I was one of the reasons why I admit I was late, because I was en route, and I had the honor and privilege to celebrate my father's 80th birthday over this past weekend, and doing so was fortunate enough to see some family I haven't seen in quite a while. Some of them I haven't seen in over 30 years. And so it was a reminder to me that, you know, each and every day we need to cherish and do what we can to improve, both for ourselves and as well as services and access for everyone who's in need of them. And so, like I said, I wanted to keep my comments brief. The other thing, and I don't know if Scott covered this during his, and if I apologize if I'm being redundant, but the emergency orders, the COVID emergency orders are due to expire at the end of this month. And so beginning next month, we will be doing, and there's notices have been going out, and with very limited exceptions, we will be doing live meetings, and in order for us, or in-person meetings, and in order for us to have a quorum for us to get to determine or resolve action items, we need to have a physical quorum of individuals or board members in the meeting room. And there's very few, I think it's emergency circumstance, emergency, and what was the other one? Good cause. And each board member is allowed up to 2 each of those a year. So for the most part, we're going to be meeting in person, and our meetings, for those of you who have joined the board subsequent to this pandemic, is that it's at the training room at VCBH, and I believe the address is 1911 Williams Drive in Oxnard, California, and it's on the first floor.
Thank you.
But we will continue, though, to have hybrid meetings for the public. So the public is allowed, or this stream will be available. Remote access will be available for the public to participate in going forward as well, though. So board members need to be present in person. The public may attend and participate remotely. So I just wanted to make sure we're clear moving forward on that. And I believe that's all I have. Any questions or comments?
Congratulations.
Oh, thank you. All right. So moving on to committee reports. Let's start with 12A, disparities reduction. Marlene?
I believe she's no longer on the meeting. She popped off.
Okay. So moving on to B, Adult Services Committee, Game Brooking and or Chris Tejeda.
Thank you. So yes, we met in January 5th. We did not meet a quorum at the meeting, but we did continue, and it led to some good discussion. Some of the things that we kind of took the time to kind of outline some goals moving forward and different areas of focus that we'd like to discuss and kind of explore more in the future. So some of those items included looking more into some of the full service partnerships in the county and different metrics and effectiveness and outcomes, trying to learn more about those. We're also interested in following up regarding the Stepping Up initiative and seeing how, now that that's had a little bit more time to develop, how it's being implemented in the county and how the transitions from people in jail to services outside of jail are going. There's some discussion related to different facilities, different boarding cares and IPUs. And let's see, just going through my notes, we discussed some of the MHSA programs and reports that have been produced in the past. And Susan Whitewood gave us a great update on housing in the county and some really great initiatives that are being led in that department. And some of the difficulties that they have as far as the rent cost and the fair market cost and what it costs to house people in the county and some of the hurdles that they run into. And we look forward to having a report on that in one of our upcoming meetings. And so that's pretty much our meeting. We look forward to having a quorum. Again, I want to reiterate to everybody, it's going to be this Thursday before, we have to appear in person. So please, if you're on that board, please show up or let us know. Yeah, again, we set an agenda, and in this upcoming agenda, we're also going to dive more, hopefully with a full quorum, and see everything that the focus is a full quorum of where we want to go and what we want to address. So thank you.
Thank you. Are there any questions or comments for Chris? Liz Warren.
Thank you. I just wanted to remind Chris and the folks on the Adult Services Committee that we're getting a presentation from VCBH next month on FSPs. So I think that you'll find that very informative. So thank you.
Thank you, Liz.
Thank you. Anyone in the room?
No.
Nobody? All right. Thank you very much, Chris. Moving on to C, Prevention Committee, Janice Gardner.
Okay, thank you. The Prevention Committee was very honored to have VCBH Substance Use Services Chief Raina West attend the last meeting that we had. Greg Bergen, from MHSA provided an update and told us that the community planning process held in person and on Zoom concluded last month. There were about 100 individuals who participated in over 5 events. The analysis and preliminary plan will be circulated in February and March. Feedback from the MHSA 3-year Community Needs Assessment Survey can be found on the VCBH website or wellnesseveryday.org. The Prevention Committee had a presentation entitled Adapting Efforts During COVID and Prevention Services Update 2020 to 2023 from VCBH Prevention Services Manager Dan Hicks. Prevention works upstream, meaning prior to one needing treatment. Among other efforts, VCBH and Prevention Services created a new digital outreach, a strategic plan of collaboration, gathering with purpose, promoting awareness of risks, addressing health disparities, opiates and illicit drugs, fentanyl and marijuana harms, underage and binge drinking, DUI prevention. They also created a Healthy Choices campaign. The Healthy Choices has a lot of phone numbers. If you need a phone number for suicide prevention, to find out where the one-stops are, syringe replacement, and of course 911 and 211 are listed there. They also have a new community connection newsletter series that was created that connects CBOs, collaborators, and the public. Overdose prevention programs increased. Their naloxone kits are now in 52 sites, and some kits for businesses and others have additional naloxone doses included in their kits. We also have fentanyl and fake pills campaign, prescription drug abuse and prevention, vaping and education to parents, families and schools, and all are in Spanish. Spanish language resources and an expansion site for news services in South Oxnard also. More than 1,500 lives have been saved due to locks on Ventura County. And you might have seen in Director Gilman's report, the new LED Fentanyl is Forever campaign trucks that are going around all of Ventura County 6 days a week. There are 5 trucks. And the drivers have a supply of resource materials in Spanish and in English if people come up to the trucks and want to know more. And let's see if there's anything else. Let's see. Okay, and there is one more thing about that, and that is that the Fentanyl is Forever campaign awareness promotion. There is a poster and some information at the government center in the lobby as well. So that's it for prevention, the prevention committee report. There's a lot going on in SUS. It was SUS oriented this past time, as well as finding out about the new developments within HSA.
All right, thank you. Oops, sorry, didn't mean to cut you off.
I think Liz Warren has a question.
Yes.
Yeah.
Thank you,
hi.
Janice.
Thanks, guys. Yeah, I sit on the prevention committee with Janice, who chairs it. I just wanted to say that the prevention side of the house is doing some extraordinary work. And one of the most powerful marketing campaigns they did this previous year was the videos with family members who had lost loved ones to fentanyl overdose. And it was extremely powerful. And you may have seen it. It was run on MSNBC. It was run on local cable and national cable. It was extraordinary. And I'm just happy to report that Chief West has reapproved that campaign and that they will be moving forward once again doing that messaging. And it's if you haven't seen it, I strongly recommend that you do. But that was a very exciting announcement. So because over the years I've watched all of the work that they've done, and it's really one of the most powerful things. So if you haven't seen it, check it out. But they're doing it again for another year, and everybody's really happy about it. Thank you.
Thank you for mentioning that, Liz. Very important. Thank you.
Thank you. Any other questions or comments for Janice? Any public comments?
Nancy
Oh,
has her hand.
Nancy, all right.
Janice, I was just wondering if those advertising vans that are running around, I wonder if that would prompt somebody who was actually in an emergency thing needing Narcan. Would it be possible for those trucks to have a supply of that, or are they considering that?
You know, that's a great
Because, you know,
question.
if you just saw it and you thought, I need that, or that's a place, or I could ask, you know, every opportunity that we can put out there. So you might ask them.
I will ask. I know that there's training that goes along with having a Narcan kit or dispensing Narcan.
Yeah, and there's certain reporting responsibilities when you distribute.
Yes, absolutely. So, but I will ask them about Narcan, and if they have a supply, and if there's a line of them, let me train.
You know, it may not be anyone come forward, but you just never know.
You never know. Okay.
Nobody has to walk into a hospital or a police department or anything, if they just walk into that truck. It's pretty benign.
Let me find out.
Okay.
And I'll get back to the group next month. Okay, are there any other questions? Herman?
Herman Corteza.
Yeah.
Hey, good afternoon. Just wanted to share that our Tate Tunnel, it's part of our agency initiative statewide regarding provide a Narcan and save a life. We actually provide free Narcans to transitional age youth between 18 to 25. It does require training, and the youth have to sign off on it. And again, also be able to use responsibly with somebody there to provide the Narcan. So we do provide that training. So if we have any youth who might in need, please redirect them to the Tate Tunnel.
Thank you.
Thank you so much for that information. We'll get that out too. Thank you.
Any other questions or comments for Janice? All right, so moving on to 12D, Youth and Family Committee, Kevin Clarisi.
Yeah, thanks, Michael. Youth and Family met last month. We had a nice discussion. It was our first one of the year. So there was a chance, I think, for our division manager, Cheryl Fox, to kind of touch on some of the changes. Director Gilman kind of already touched on this a little bit of just how Cal AIM is affecting really all countywide divisions, but in particular, Manager Fox was sharing about how the youth and family is becoming more of an integrated system, and just with the billing changes and just the different elements that are coming on, they're really working hard to try and make it a more integrated system, particularly for adolescents and youth. She did share that some good news that there has been a new clinic administrator that's been hired. This is serving both the Santa Paula and Fillmore area. So that was encouraging. And she touched a little bit too on the sort of what I frame it as sort of this pilot program. We talked about our rollout of how we're going to go back in person from Zoom. The divisions are also dealing with this in the sense that they've been doing so many virtual meetings, and now how they're trying to add a nurse in my notes here of sort of joining the treatment team and trying to find that sweet spot between continuing telehealth, but also trying to get more in-person meetings with young people. So I thought that was interesting. Looking ahead, if anyone wants to join us at our April meeting, we're going to have a presentation on the Pediatric Mental Health Collaborative. This is something that's been in effect, but the groups that are part of it are going to be re-engaging it. So we're going to have a presentation on that in April. Thank you.
And what's the date of that meeting, Kevin?
It would be the second Wednesday. So that would be the 12th.
Thank you.
Chair Rodriguez,
Yes,
I forgot to add something. May I add something really quick?
sure.
That is the date of the next prevention committee meeting is March 14th. And we are going to have a presentation from a group that Director Gilman has mentioned, Be Nice. And we're very excited about hearing more about that program. And I would like everyone to please be invited. It's March 14th at 3:15 here at the training center. Training room.
Thank you. Any other questions or comments? Any questions or comments for Kevin? I don't see any hands raised. Any hands inside the room?
No.
All right. So moving on to E, Transitional Age or TAE Committee, Elizabeth Stone.
That's my karaoke name, E. So, that's funny, sorry. We actually, about halfway into the meeting, made our quorum, which was great because there were certain people that decided that they were no longer to make a commitment. So we did have a quorum. We were able to pass some things. It was rather exciting that one of the people from the TAE Tunnel, who's been a very long-term participant, had invited somebody else to attend the TAE Tunnel. So we actually had a guest, and I believe that individual may join. So we really, the emphasis is to get representation from the people receiving services, right? So, and then a lot of the discussion really was around different ways of engaging people. We had changed the time of the meeting, hopefully to connect with folks after school. But things are just so uncertain everywhere. It's very hard to do that. So we kind of charged with looking at perhaps some ways of getting not necessarily financial incentives, but other kinds of things that would respect the people's time, and why would they prioritize coming to a meeting that seems like a lot of business, right? And just kind of how to really, and Herman, you could probably talk to this too, right? Engaging young people. So to get them to come to the meeting. We had a really interesting, I felt, presentation on the new mobile crisis team, the TAE mobile crisis team. That consists of 3 people, a clinician, a community service worker, which I guess is similar to a case management position, and a peer. And within like the 2 or 3 weeks that it had been working, the peer, who actually was well-trained and had extensive experience, was able to make connections with folks in a way who are experiencing crisis in a way that the clinician who was kind of, doing the assessment and versus the conversation with the peer really kind of made a very big difference in engaging people. So for me, that was, again, we know it's an evidence-based practice, but it was really nice to hear what it's like in the field. I guess I'm going to conclude with that because I'm also very concerned that the last 10 minutes I've lost the internet 3 times and I'm going to do a presentation next. So I'm a little distracted, sorry. Any questions or comments?
I have a question.
Sure.
Elizabeth, can you repeat? You said the crisis team has 3 now.
Staff.
they're 3 staff, and are they going out? They're all going out together?
I think they go out maybe in groups of 2.
Okay, and it's a
Yeah,
peer.
2 at a time.
At least.
So it's a clinician, a community service worker, which is analogous to a case manager, I believe, correct?
Yes.
Mhm.
And a peer,
Oh, great. That's
and they're working Monday through Friday, like 8 to 5. So sometimes they're responding to crisis, sometimes they're doing follow-up, sometimes they're doing follow-up to other crisis teams. And there is a vision of partnering further with law enforcement. Law enforcement is often called out when there's a weapon involved or the other teams aren't available or whatever kind of relationship. So it actually sounded very promising and encouraging.
Thank you for that. Also, Chair Rodriguez, Marlene Torres sent me a text about the Disparities Committee. May I read it if we have time?
We're not hearing you, Michael.
Are there any questions or comments for Elizabeth? For her,
Yes.
okay,
Yeah.
looks like Chris.
Just for the area of focus, are the area that they're providing services, is it distributed throughout the entire county or is it mostly in Ventura or?
Yes.
Oh, okay.
Entire, yeah.
It's countywide, yeah.
Yeah.
It's just, but it's for TAU.
Thank you.
You're welcome. No, it's exciting. And it's a grant, so they're gonna be pursuing, I guess, funding for sustainability.
Michael, did you? Okay, thank you. Did you hear me about Marlene Torres?
Yes, I want to make sure, are there any other questions for Elizabeth Stone?
None in the room.
All right. So moving on to Janice, reporting for Marlene Torres.
Okay, thank you. Marlene said that essentially we've not been able to meet for lack of a quorum. So she wanted to announce that the next Disparities Reduction Committee is on March 2nd at 4:30. And she said it would be helpful to know in advance if people will not be able to join. Thank you very much. So hopefully everyone that is interested in this will be able to attend that meeting. That's it. Thank you.
Thank you. So what my notes are showing is that Adult Services and Disparities are having meetings on March 2nd, but at different times. The adults is in the morning and Disparities is late afternoon. Is that correct?
Yes.
Yes.
I'm sorry.
Okay.
Seven?
Oh, Marlene said March 12th. I don't know.
Oh, March 12th?
Oh, but we're meeting on the 2nd. Oh, sorry. I'm so sorry. Wait, that was a wrong
don't panic.
text. Hold on.
Just
March
there's-
2nd at 4:30. Yes.
Okay. Thank you. All right, moving on. Any questions for Janice on behalf of Marlene or reporting for Marlene? Okay, moving on to item 13, a presentation by Elizabeth Stone, peer support, values, funding, and next steps.
Nancy has a question.
Okay,
I just
Nancy.
had a quick question about the Marlene's committee. Has that committee ever had a meeting?
Yes,
And is
it's
it,
been a couple, it's been a few months, but they've had meetings. There have been meetings that, because I know I've attended a couple, at least a few.
okay,
Thank you.
Sure. Any other questions?
Michael, I just wanted to say something. I'm gonna check with Arlen about that. I haven't given it March 7th. It's always the first Tuesday, so I'll have to check, but we'll be sending out the meeting announcement soon. And anyway,
Yeah, she was actually multitasking in another meeting, so perhaps she just put down the wrong date.
oh,
Okay, thank you.
Okay, yeah, please let us know.
will do. Thank you.
Thank you. So any other questions before we move on to Elizabeth Stone's presentation? All right, Elizabeth.
Thank you. So Jackie, can you make me a co-host so I can share screen, please? So I'm going to talk while that's happening. This presentation is called Peer Support, Values, Funding, and Next Steps. Thank you. And well, one second. One second, guys. Sorry. Okay. Right. So I asked Michael, because there wasn't a presentation at the time, if I could also have some time, because I've been hearing some comments that kind of concerned me, and I wanted to just go back and kind of do a little refresher on some of the key values of peer support, kind of what's going on in general, and as well as the organization that that I'm building with other people. And okay, and as you can see, like the last time that I did an update on what was happening peer-wise across the state was a little bit over a year ago, 12/19. Okay, so these quotes are from a book called What It Takes. It's a brand new book that just came out. Can't really see it, but it's over here. This is a book that was published by the National Association of Peer Supporters. It's actually been in existence for over 10 or 15 years. That's a collection of a lot of really interesting information. And it kind of, you know, the starting point, you can see it's near the beginning of the book, is really, you know, it's a natural thing when people have shared experiences. Oh, wow, is there a way that I can get those off? Because they're not on my screen, or you have that. Okay, thank you, Jackie. Yeah. That is kind of a natural thing that when people have shared a personal challenge, that they want to support other people in that. And so it's kind of, you know, there's that idea. And that this idea of that there's comfort and that there's some period of reflection. So people have gained some wisdom and experience of that. And just the value of someone who shares that experience. And I think what I also want to share about that is, you know, a lot of times we're talking about peer support here in the behavioral health care setting. But peer support actually exists in so many areas. Actually, you know, as James shared, there's extensive peer support among the veteran community. It's actually very inspiring to me. A lot of the work they do in the VA has a lot of very interesting stuff. Things veterans are doing, people in law enforcement. Actually, Ventura Fire Department is has a nationally recognized peer support program. So it's quite around a lot. So again, what it really means is that there's a partnership, which is different than, you know, necessarily a helping relationship. There's a partnership because people have some lived experience or expertise that there's a commonality. It doesn't mean it's identical, but there's a commonality, right? So this is Cal Mesa's very recent document. They're talking about some of the new certifications coming out: empathy, validation, peer support specialists change lives, right? And they model hope for a better future. So that's Cal Mesa's idea. And the way that this is the reason, one of the reasons this is again in the forefront in terms of behavioral health care is this legislation, SB 803, which was passed at the end of 2021. And this is their definition. So I'm going to be addressing this more specifically. Who a peer support specialist is in terms of the state of California. They're 18, they're self-identified. This idea of the process that they have lived experience of the process of recovery is actually extremely important. So, you know, it might be different when people are kind of commiserating about the challenges they have with friends or family that may not necessarily be living the way that they would like them to. But having the experience of a process of recovery is a different experience and a different sort of support that we would hope people share. And again, it's not just the way the law was written. It's not just people who have direct lived experience or expertise, but it could also be the parent in terms of the family system or a family member. And I raised this, I shared this, I think in the other presentations I've always done, because I think it's really important to keep in mind. There objectively are lines and a design on the ground. Depending on where you're standing, it's perceived and interpreted totally differently. It is totally different for each person in their perception, and it's totally correct in that perception. So the problem is when people want to, when it's challenging to make space to recognize that there's differing truths from the same objective situation, right? So I bring that up because this again is very salient or happens frequently or feels like it happens frequently, especially for people that have been labeled psychiatrically or diagnosed. This is from Pat Deegan, who spent several years in the hospital for schizophrenia when she was 17. As you can see, she eventually earned a PhD. This is how the psychiatrist is writing his or their notes about what's going on. This is the unspoken thoughts that Pat Deegan's having because, right, she's the sick person, so her words are not trusted. It doesn't, you know, where there's this power imbalance, right? So her perceptions, her experiences, oh, that's just her illness, da, 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 da. But this is what's real for her. And part of this, you know, my experience and my voice were silenced. But part of the reason this is important is because a peer who may also have had this experience of feeling like their perception and interpretation and the way it went through may be able to connect to this feeling and create space in a different way for someone to express some of this, right? And sort of be curious about it. It may or may not be true for someone, but we need to hold space to kind of explore that in a way that's a collaborative partnership, not where people are going to be penalized or labeled additionally for expressing disagreement with an official record of what's happening. You know, and this is kind of what it looks like sometimes, right? We need to keep you safe, right? So it seems pretty severe, but I'll tell you, when I show a picture like this in a peer conference, there's like lots of moaning, right? Because what frequently this looks like for people maybe who are incarcerated is an empty room with a hole or a broken toilet, or perhaps in an locked inpatient unit. People are frequently stripped, 5-point restraints, and may be injected with drugs that they may or may not feel is helpful for them. So again, the perceptions are going to be very, very different. And so, you know, I've learned personally quite a lot from the disability rights movement, which is now called disability justice, right? And kind of calls out things around ableism or saneism. And nothing about us without us is really, you know, the rallying cry from disability rights. And some of these really key values are empowerment, human rights, independence, integration, which means being a part of a community of one's choice, self-help and self-determination. And I think I spoke last month because, well, I'm just going to be really clear. These are really important points, right? Also in SB 803, which is the original authorization, is this idea of recovery. And actually, this quote of recovery is the definition that SAMHSA, the federal government Substance Abuse and Mental Health Services Administration, uses for what recovery means: a process of change through which an individual improves their health and wellness, lives a self-directed life, and strives to reach their full potential, right? That's you know, it's not like reaching a point, it's quite a lot, and the person is an active agent and partner in the creation of that. And here we have this, if you look at these dates, 72, like, we've known for a very, very long time that the majority of people, over 2/3, right, are going to be able to recover with the correct supports in the community, with staff who believe recovery is possible, with multiple things. So again, it's the foundation is remembering and believing that it's possible. It breaks, you know, breaks my heart, but it just pisses me off too when I walk into a peer wellness center and said, oh, that person's a success story. And it's like, oh, so everybody else is not? Like, even among people that are peers, especially if they're working in a medical or clinical model, are still have these kind of biases against each other, you know? So these are some quotes from an article called What Recovery Means to Us. Sherry Mead, you see on the bottom, the authors here. Sherry Mead is a person who has lived expertise as well as graduated from social work school, and she's the creator of intentional peer support, which in my mind is the gold standard of peer support training. And Copeland is Mary Ellen Copeland, who was the creator, again, has direct lived expertise, also a family member, and worked with a community of people, and actually got a vocational rehab grant, which is how she got the data and crafted, RAP plans, wellness recovery action plans, right? So risk is inherent, right? How come some people are allowed to make bad choices, other people aren't? It's up to us to make choices. Each of us has different ideas of what a full and rich life is. Ask us, don't make assumptions, ask us, right? And so again, this is depending on your perspective, this slide means many, many different things to you. I would suggest and have experienced family members kind of commiserating like, oh yeah. And then people that identify as the intended recipient of help kind of going like, yeah, that's not really helpful what you think is helping. Please listen to me. You know, so again, your perspective, even on something as perhaps, you know, non-controversial as this, really looks very, very different. And this again, this is from Pat Teagan, and I think this is a really, really helpful slide. And actually, I have a number of handouts on the table, and I guess I'll be included in the minutes. And this is one of the slides because I think this is really helpful. And I think some of you have heard me probably every meeting mention, frequently we're on either end of this balance, right? Traditionally, running the person's life for them, we wanted to protect them. I think I know what's best. And then over here on the other side, we have, oh, you know, they said they don't want services and we just leave them, right? So really none of this is acceptable. This is, neither of these are acceptable, right? There's really a thing in the middle where the person, you building a relationship, you're supporting and empower the person, you're building in a relationship with deep listening. There's things that you invite people to consider. You support people in building decision-making skills and the skills to do this. So there's the dignity of risk, right? The person gets to have the dignity of choice, but there's also this concept that he talks about as a duty to care. So we're supporting somebody, we're engaging with somebody, and their choice is to do something that really concerns us as not safe. How do we have that conversation? We're not on either end. It's like, we're not going to not let you do it because we think you could get hurt. We're not going to say, well, whatever, because you want to do it. In the middle, how do we have this conversation to say, I'm really concerned about this. These are the things I'm worried about. I would be concerned if something were to happen to you. Like, how can we, what do you think, help me understand how you got to that decision. If this is something I'm worried about, do you think that there's a way that we can work in some safeguards so that, you know, I won't be as worried, or I know that you've got some backup plans, right? So really, you know, almost everything I see that's not working is either of these, right? And especially since I'm doing so much work currently with people that are unhoused for a very long time, especially, you know, it's like, oh, they said they didn't want services, da 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 da. And then next thing you know, they're over here because they're now incarcerated, right? So we got to get out of these extremes. Something I'm just going to argue, and that's my perspective on care court. We kind of talked about that last time, right? Too again, and well, I'm going to address that in a little bit. Okay, so there is again this misperception, right? There's some reason, you know, and I'm putting this in because I think it's important to keep reminding people. Again, some of the best intentioned people kind of forget these things sometimes, and you know, I participate in a number of things with the NAMI in Santa Barbara. And I was at George's, who's their president for a long time retirement, and his kind of things like, oh yeah, we're all this family of people that didn't want to have to be in this family. And I'm like, George, you understand that that makes you feel good to say that, but you are literally saying you have a family member who you preferred would not be who they are. Right. So these are these kind of microaggressions, right, that we talk about. It's literally like it's just kind of being cognizant of how, or conscious or aware of, you know, the impact that some of these statements kind of can make on people. Inadvertent, best intentions, and just not kind of following it through all the way. Right. So again, this whole idea of person-centered. From a, you know, ideally peers and ideally any provider is doing person-centered care, right? They've got all these resources, they have opportunities, you're partnering with the person, and the person decides with you like what they would like to pursue, what needs they have. And these again, this is again from this book, What It Takes. I think this is just a really helpful overview. I probably should have made this a handout also. I'll include this in a minute. Well, it'll be on the thing, but I'll make it a separate thing. Because I think this is just a really helpful synopsis, right? These are some of the ethical values, just really reminding. These are the values that are really, really important. Respectful, be curious, right? It's not like, oh, we both have the same diagnosis, I know what you need. No, like it's a spectrum. Diagnoses are, you know, very subjective. Ask people what's going on with them, right? Equally shared power, strengths focus, all of these kinds of things, really, really important. And this is actually very interesting. This was another thing that challenged my own values and advocacy. This is from a study when I was looking at, did a presentation at the CAPRO conference last fall or summer. On shared decision-making, because at that time, Care Court really emphasized shared decision-making. And I knew it would pass, and I'm like, let's just really build up the shared decision-making part. So this, and it's from Australia. There's quite a lot of interesting information from English language countries around the world, ex-UK, part of the United Kingdom, just like the US is. And they've done a lot more with including people who've been diagnosed or identified as service users. And they actually found that, you know, having conversations with people and analyzing their language, that there were different kinds of support and that people wanted. And so each of these types, and again, this is just a very quick overview, has a different role of like, don't tell me what to do, or like, oh, I do want some advice, or my family member's input is important. Like different people view that different ways. So again, it's being curious for what works for the person. Like I'm very much, I think, the inward expert, right? I do a lot of reading, I have a good sense of what I want, but then other people may not necessarily want that. So again, and when I also say like, I want to be a voice and an advocate, I also know there need to be multiple voices because we all have a different experience of what works for us and what's helpful. You know, but this is always a great question. Could you help me understand what that means to you, right? Not making assumptions about something, being curious. And moving quickly into the funding. Again, so this is the law, this is from SB 803, this is what peer support specialists are. These are the services that are funded and conducted by a certified peer support specialist. Prior to SB 803, these are all of the ways that peers could be paid, peer support services could be paid, and continue to be ways that peer support services could be made. People that were working as peers, either as promotoras or community health workers or outright as a peer title, were already being paid in many of these ways and were concerned like, oh, I have to take a test, I'm not going to test, da, 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 da. There was a lot of concern among people throughout the state. And so very early on, as you can see, the behavioral health information notice from November of 2020, Department of Healthcare Services reminded people, these are all of the ways that we can pay for peer services before the changes with SB 803 are put into place and can continue afterwards should a county choose to, right? And in part of the law of SB 803 was for the Department of Healthcare Services in their negotiations with the Center for Medicare and Medicaid Services, the federal agency, to create a new Medi-Cal provider type and service categories so that peer support specialist services could be reimbursed through Medi-Cal. This is still in process, right? They're still under the negotiation of that, and my understanding is that the service codes are still being developed. Cal Mesa, and this you might remember from earlier, Cal Mesa was the entity that was chosen to administer the certification process, right? So these are some of the things that they were doing, and this continues to evolve as well. These were the kind of certified peer support specialists indicated in the law. General, so that's kind of where we are now. This exam, people were grandfathered in, people are being trained, people have taken the exam. A few months ago, there were 134 people throughout the entire state who passed. These specializations, Cal Mesa is currently having hearings about that. They've got some tentative proposed curriculums. Oh God, it looks like I lost my internet again, right? Did you lose it? Yes. Okay, I'm gonna try to, I'm sorry?
Still on.
You can't see my,
You just need to share it again.
okay, thank you. Sorry, guys. Okay, did I do it? Learning all these skills. Okay, so their current, it's going on and off, right? I don't know. Can you see it? No. So frustrating. I'm gonna keep going just to respect people's time, I think. Sorry, guys. I don't know how to do this. My phone. Okay, but I have the pages for it. So, well, I got this. All right, so they're currently having meetings about, says I'm not connected to the end of that again. And I tried to send this to Jackie, but it's too large, so we're not do it either. I'm gonna keep talking and I'm gonna do something I'm never good at, which is multitasking. Okay.
Do you want help?
It's the internet keeps going on and off, so it's not necessarily something we can do. Okay, so they're looking at the, especially the homelessness justice system and crisis system specializations. There are draft curriculum out right now. There's some listening sessions coming up in the next month. When I initially wrote the response to the RFP that funded the organization that I'm kind of coordinating right now. I don't know if you can see, I'm trying to get in, Jackie. the intent was to really train people in those specializations, so we'll kind of see what happens on that. It's going on and on.
I think it's because of your documents, because I'm on.
I'm
So
sorry.
I'm on the internet, so you should be on the internet, but I think your PowerPoint maybe is just,
No, it probably only has a certain amount of,
yeah, that's what I'm thinking.
right, and so
'Cause you're
being
on-
on it is kind of taking, like
Yeah.
usually when there's more than one person on it, it doesn't. I don't know. It was fine the first hour of the meeting and then it just kept doing this.
It's doing it with me too, so
So,
it's raining. It's raining.
okay, so what I really kind of wanted to show partly also was, so because we've heard of these different funding opportunities that are coming up, right? So the workforce training, the behavioral health workforce development is 1/3 of funding that's going toward, COVID. So the state took all of this, took a lot of the COVID money to really bolster behavioral health things, right? And part of that is the, part of that was the behavioral health workforce. The other two parts of it, this is a slide from before, but you guys will get all of the slides, is the behavioral health continuum infrastructure program, and that's the 6 rounds that we keep hearing about. And also community care expansion program, which was mostly for adult and senior care facilities. That's just some background. So part of the thing to keep in mind as peer support services move toward Medi-Cal is this concept of medical necessity. So that's being massaged somewhat. So there was very interesting early on in the Michigan Medicaid waiver, because Medi-Cal was actually the California only version of Medicaid. They defined medical necessity as community inclusion and participation, independence, and our productivity. So I thought that's a very, very different concept of medical necessity. And I thought that was really kind of inspiring. And then we, of course, we're in the middle of CalAIM right now. So CalAIM is this total restructure of Medi-Cal that has a vision of fully incorporating peer support specialists, which in some cases are called promotores or sometimes called community health workers. So I have a couple of slides on what that looks like, some of the services that are really going to focus on that. I also had a slide on the community, and then because we're talking about funding, community wellness mini grants, as we saw. Part of this also behavioral health workforce funding is there's a round 2 for the mentored internship program, which BCBH currently participates in, but they're also targeting peer organizations. So they really are expanding that. And that is part of the place that the state is directing the opioid settlement funds. So that's something that we're really looking at because we already have a partnership with the prevention department. So we have Narcan, we distribute, we're an institutional distribution site for Narcan. So that looks somewhat promising. So that's meant to be the internship. And part of what they were looking at that was especially attractive to me was people in alternative high schools and maybe community colleges, and also outreaching to people that are currently incarcerated or that are coming out. So really building these kind of service places that I think peers are going to be great with. And the other thing is, I think I mentioned, but just more formally, we're talking about funding. There is a commitment from the state to continue the initial peer grant that the organization FIND has through December 31st, 2024. And so we're just waiting in May or probably next month, we'll know exactly how much funding that'll be. The initial funding was $183,000. So the second round of funding, which because we're in compliance with everything, will be somewhat less than that, but we're not exactly sure how much less. And as I mentioned, we'll go from May through December 31st of the following year, 2024. So very excited about that. So next steps, I kind of shared about the 8 dimensions of wellness. So again, And this was very interesting to me. The first question on the eval core interview was, how do you define mental wellness? I was like, kind of really wasn't expecting that. But, you know, 8 dimensions of wellness: emotional, financial, social, spiritual, occupational, physical, intellectual, environmental, and just kind of remembering someone may not be doing very well in one area, but have very good strengths in another area. So again, as we're looking, we're calling it whole person care, whatever we're calling it, there are all of these parts of an individual being open to that. Pat Deegan has a thing called personal medicine. Personal medicine are things you do, not things you take, that actually help you feel better. So for me, that means swimming and, you know, teaching swimming, doing karaoke, music, volunteering for people, creating a lost role, things, just things that you like to do that help you. For me, to be out in the sun is a huge important thing. One of the studies that is shared from a survey from 2014 in that book I mentioned, about what are the things that help peer support specialists feel satisfied. And I prefer to like talk around so you can see things, but responsibility that reflects the level of training and lived experience, feeling respected both by supervisors and colleagues and by the peers who receive services, perception of having sufficient training to do the jobs. And hear me quite often talk about how important it is for people to be well trained. Working in community settings or peer-run programs versus kind of clinical or medical model. And the perception that their skills are being utilized, right? So very frequently we hear tales, and I'm not pointing fingers here, this department particularly, saying in general, we hear tales of, well, sometimes we've heard in other counties, people were asked to wash cars, right? Or serve coffee or whatever, or just really not being utilized to the best of their ability. So there's kind of that. There's a slide I have on challenges that, again, I hope you guys are able to take a look at when you do get copies of this. Some of it has to do with the kind of mismatch between recovery orientation, which means shared power, reciprocity, and mutuality versus kind of that hierarchical medical model. Some confusion about roles and kind of peer drift and like what are peers actually doing, being perceived as a token. There's a quote I love in this book, like tokens are for arcades, right? Not for like, oh, here's like, actually when I had a 2 or 3 months, I was doing some work. I was asked to do some work at the STAR department, and I was introduced by the person that I was kind of partnering, supporting with. This is my peer. I was like, well, no. Like that just felt very uncomfortable for me. So, and negative staff attributes. I've done a whole presentation on, you know, you get the job as a peer support specialist because you self-identify that you've had certain mental health or behavioral health challenges, and then clinical staff will tend to interpret behavior that maybe makes them uncomfortable or they've learned to look at in a checklist as that you're not maintaining your mental health, instead of kind of changing, broadening norms and acceptable kinds of things. So the next part I was really focusing on FIND, which is the organization that I'm coordinating right now, which stands for A Friend Indeed, and has the support of one of the members of that organization here today. So thank you so much for being here, Stacy. Peer-directed services and advocacy. This program is very much backed by multiple evidence-based practices that I've had training and years of experience with. Intentional peer support, psychiatric rehabilitation, the 8 dimensions of wellness, and true livelihood, which is workforce and job development from Denise Bisonetti. The focus is on supporting people who have some experience, and much of this is overlapping, with mental health challenges, substance misuse, justice system involvement, and homelessness, and kind of some of it's direct services, some of it's advocacy, but there's always that interaction of, as we encounter people, we find there isn't a service, so how we have to do advocacy around that. Advocacy then can mean there's other service options, but it's also grounded in this whole idea of people getting training, which is some direct training and some on-the-job training. So the current mission is to expand the service and support options available to people with current or previous experiences of mental health challenges, substance misuse, being unhoused, or interacting with the justice system by providing robust pre-employment and on-the-job training for full spectrum service delivery and advocacy from the perspective of people with lived expertise. I had a picture of the front of our office. We have an office, really nice suite in Montalvo that I'm really excited about, and it's a really nice space. And some of the plans that we have are building some additional groups, especially alternative to suicide, surviving interpersonal violence, math studies. Going to be responding to the RFP for the certification training for people that have experiences of homelessness and justice system involvement. And of course, ongoing training and off-the-job training as funding allows. And the real vision is peers where we need them, like in the emergency departments, in locked facilities. Currently, I'm able to visit people in the jail. So just kind of expanding that into a more formal thing. As Stacy and other people get trained, they're also interested in supporting people in the jail. At some point, having a peer respite, that's kind of an acute space, but it's not necessarily clinical, and it's unlocked, voluntary, and staffed by well-trained peers is very important. I have some information about programs on shared decision-making, which again is that middle ground on that slide. So peer respites, peer-directed programs, common ground, psychiatric rehabilitation, intentional peer support. I presented here on psychiatric advanced directives. I've met Mary Ellen several times and a lot of work with BHAB. One of the challenges that remains is people living with extreme distress or experience of mental health challenges remain seen by others as incapable or dangerous because we lack insight and therefore need others to make decisions for us. So some of that means that we need advocacy that challenges that, adopting shared decision-making throughout programs, developing additional program options, education and training on programs, models, and tools. Sometimes I talk about things that are being done in other parts of the state or the country or other parts of the world, and they're not many people may be familiar with them. And again, Scott, I always so much appreciate you when I bring things up. You seem to really have a great sense of a lot of things. Kind of have a last slide here. You know, the bottom line question that when you're supporting people to make changes and support them in things is what gives your life meaning, right? It's not an amelioration of symptoms so that everybody else is comfortable. It's like, what makes you want to keep living, right? How do we connect with you so that you feel motivated, that we can support or surround you with things that help you feel motivated? So, and the very last slide were the questions that I kind of asked the department to answer. So I don't know if you were able to collect some of that. BCBH did sponsor, I don't know, 40 something or more people that were grandparented in. There is some, you know, funding again through Cal Mesa. So I'm curious, were you able to get any of that data or not at this time?
Yeah, I didn't. I was on.
Oh, yeah, because you had, I'm sorry, I didn't mean to put you on
No,
the
that's no
spot.
problem.
Sorry, Scott. Yeah, so, so maybe next time it'll be really helpful to hear some of this information, training vendors and things like that. So that was a very long, thank you for your patience. Clearly I'm passionate. Wish I had more that I could share. And again, there's a number of handouts here and they'll be included in the minutes. Thank you, thank you, thank you. And I'm totally open to any questions. See, we lost 5 people during that, okay.
Are there any questions or comments? I see Liz Warren, and then I'll ask if there, and then Cheryl Heitman and Herman Corteza. Liz, you're on mute.
Thank you, Chair Rodriguez. Elizabeth, thank you so much for going over all that information. I think there's always time and the necessity to walk people through this timeline that are new to the process. And we have a lot of new folks that are on the board. So I appreciate that. Thank you very much. I just want to make a couple of comments. I'm glad that you brought up the book, What It Takes, because it's an excellent book. And I recommend folks to definitely follow Elizabeth's recommendation to get that. I want to talk just a little bit about the fact that the consumer advocacy movement came right alongside of the civil rights movement in the 1970s. And that's when the term "nothing about us without us" was developed. And in the 1980s is when we no longer refer to ourselves as patients, but we use the words consumer and client. And then we moved further into the 90s, and that's when the adoption of rehabilitation language was utilized. In 2007, which is only 16 years ago, peer support was recognized as an evidence-based model by the Center for Medicaid and Medicare. So I just want you to take a moment, think about everything that Elizabeth just walked you through, and realize that this has only been an evidence-based model since 2007 in terms of the federal government recognizing that. And then, of course, in 2020, we had SB 803 signed by the governor, making peer support specialist providers. The one point that I wanted to talk about that Elizabeth made, which is very important, is the dignity of risk and the duty to care, and finding the balance. And I think one of the things, and I've had this conversation with Director Gilman and other advocates, and Elizabeth as well, we're big proponents of education. And I think in order to look at the protect versus neglect, we have to educate our clinicians and case managers and VCBH staff, many of whom may be new, about recovery culture, what peer support specialists do, a lot of what Elizabeth just went over, so that we get to that place of parity and we can get out of the adversarial relationship that always presents itself. Well, I would say, I don't want to say always, but a huge percentage of the time presents itself when a client is dealing with a service provider. So again, thank you, Elizabeth, for going through this, but I just wanted to share a couple of other comments, and I'll just say Sherry Mead and Mary Ellen Copeland, Pat Deegan, they're kind of like the early pioneers, and I'm very grateful personally as a consumer that Mary Ellen Copeland developed the RAP curriculum and program, because when VCBH did have peer support specialists integrated and embedded throughout the department, most of that started with clients taking the RAP program and then deciding if they wanted to move further with their recovery education and become peer support specialists and recovery coaches. And I will say, as someone who was who's been a VCBH client for 21 years, I really believe that saved my life. So I think it's important to remember the significance of these programs when we're talking about them. Thank you.
Thanks, Liz.
Thank you. Thanks,
Thank
Liz.
Thank you, Liz. Cheryl Heitman.
Thank you. And thanks, Elizabeth, for your presentation. Your passion is really remarkable for this. I do have a couple of questions, though, it's just a little bit of my own confusion, I'm sure, but it sounds like there's a nonprofit that's using peer support specialists, and I'm not sure in the community, I guess in different ways, but I'm curious about VCBH and how the peer support specialists are being used within that framework. I know there was training and they grandfathered some in, but are they actually currently working besides the one case that we did hear earlier about on that one crisis team? Are they working in clinics? Are they working at the hospital? Where are they currently working through the department?
I can take that.
Okay.
Currently, we've been recruiting. I think we have 3 peers on staff now. The goal is to have at least 1 peer in each of our clinics. I think what you're going to see though over the years is that peers will become integrated into all of our teams, as we go forward. There's a strong commitment by VCBH, to do exactly what we've been talking about here, is to have peers be a critical professional staff member as part of our team, not the transports, as Liz said, but really, and so that takes culture change, that takes training, and commitment for us to do. And fortunately, the revenue is going to follow, because this will all become billable service. So, but to answer your question specifically, we have 3. We also are required to have peer governed and peer operated programs and treatment providers. That's where we're looking at the RFP process to grow that. We currently have some peer operated under Turning Point. It's called the Wellness Center. And then other organizations in the community that are making attempt at starting peer operated programs.
Also remember, there's, can I jump in if you don't mind?
Sure.
There's 3 type peers, right? So some of the, I think about a third of the people that got grandfathered in are in United Parents, right? So they're parent partners. So there's those different types of peer support specialists, right? I was focusing on the group that I identify with and just really supporting on that. But, Melissa with United Parents has, there's a, is a contracted CBO. And so a lot of their people were grandfathered in and providing peer support in that capacity as well. And my understanding, I believe also, there are some people that are contracted under Turning Point, but actually perform some of their duties in BCBH space, right? Or John, maybe you can talk to that too. Or on the RISE team, like it's kind of new that they're again actual county employees, but they may be providing services within physical spaces that are BCBH spaces, but actually being paid through a CBO.
Right.
Community-based organization. That. And that was part of the questions that I had, but I think next month we'll get some of that data. I'm hoping. Yeah.
So when they're just a follow-up, when they're part of the team, which I understand, which is a great idea. So are they supervised separately as peer support specialists? Or are they supervised within the team with whoever's managing that team?
They're supervised by the manager of that team.
Okay.
I think that's, there's also, we're setting up also a secondary support. So a dotted line, but my belief, and Elizabeth mentioned peer supports where I came from in Michigan, it was a very robust and well-developed. When you have peers reporting up separately, it's them and us. Where the real magic happens is when that team really sees the peer as a member of the team, a real member of the team, and they're treated as such. So.
Great. Yeah, great. Okay, thank you.
Herman Corteza, then Jennifer Morrison.
Thank you. Thank you, Liz, for your comments, and also Elizabeth Stone for your comments regarding peers. In regards to what you just said, Cheryl, I wanted to point out that our Tate Tunnel is all peer run, including our manager and our corporate director. So, and looking at what Elizabeth Stone indicated, there's different levels of peers. And in our Tate Tunnel, we have individuals who provide health navigation services, employment services, peer-to-peer, helping hands. So these are the different levels. But I do want to speak to the justice involved transition age youth, which is critical, and encourage a lot of the CBOs to apply for the Cal CRG grant that provides employment support services to a lot of the youth or the population. But basically, we applied for it and waiting to hear and looking forward to providing services to a lot of the age youth to become peer support specialists. I'm also proud to say that 4 out of 7 of our peers at the Tate Tunnel are now medical peer certified. And the challenges that we have that we're advocating for on behalf of Cal Mesa is the amount it costs for peers to take the tests, the technology that they need, and then also where to take the test. 4 of our peers who have been peer certified in Ventura have to travel outside of Ventura to take the Pearson VUE in-person test. So I just wanted to kind of bring that up to everybody here. It's something to keep in mind that there is a lack of support in terms of getting peer certified, both in adult or transition age youth. And we'd be happy to partner up with anybody in the community or staff in BCBH to support them in pursuing that certification. As you guys all indicated, with peer certification, billing will come with it. So that will support the CBOs or in the community and the county.
Jennifer, do you mind if I just make a comment on what Herman just said? Is it okay?
Sure.
Okay, thanks. I just wanted to thank Herman and Pacific Clinics for the advocacy they did with Cal Mesa regarding test taking, because this is an online 2-hour test where you're going through this, you know, you're going through the test, but it's proctored. And the problem was that people were taking it in their homes, their living rooms. And if the online proctor decides that there's something not right behind you or next to you, they just bounce you off the test and they won't let you take it. So Herman and the folks that were advocating with Cal Mesa called them out on it and said, hey, wait a minute, peer support specialists should be able to go to an on-site testing location, just the way an LCSW does or an MFT, and take it there. It's still going to be proctored, but it's going to have the environment that is ideal for this algorithm that does the proctoring. So they've spread the on-site test locations through Southern California, and it's been challenging for those of us to get to where they need to go. I was fortunate to be able to take mine in Westlake Village. That's the closest one to what we have in Ventura, but people are going out to Alhambra, Whittier. I mean, they're going everywhere. So I wanted to congratulate Pacific Clinics for getting their 4 folks certified. The client network, I'm certified. So I know Turning Point has some certified folks, so it's getting very exciting. But you may have remembered Elizabeth talking about there were only 134 certified peer support specialists for the state of California. That was about 2 months ago. That number, I believe, has increased, but that is like thousands of applications and that percentage of people being able to become certified. So everybody has to keep that in mind when you think about, well, when can we hire certified peer support specialists and when can we onboard? It's going to take a while. And I think to Director Gilman's point is that we'll probably at some point have to do an RFP to get some additional help from providers or folks that maybe have a larger population of certified peer support specialists who could either be directly hired by the county or through that contractor, which is how it was done many, many years ago. Thanks, but thank you, Herman, because you did great work.
Thank you, Liz. Jennifer Morrison.
Hi there. I wanted to find out what is the process to get a peer support specialist? Can you refer somebody, or do they need to personally call in themselves? And where do they call?
When you say get, do you mean have access to peer support services?
Yes. Yes.
Are you talking, I guess it depends, from the department, from my organization, from K-Tunnel, from United Parents, from whom?
Well,
it would be through
I guess from behavioral health. Okay, well, so there's many different avenues. So let's just take behavioral health specifically. You would call in, and can you refer somebody into this, or?
It would be through the treatment team.
Okay.
So, yeah, and again, we have very limited number right now, but that'll be growing. But yeah, it would be just similar to requesting outpatient or requesting psychiatry or requesting peer. You know,
and then if not that, then there's other private companies, as Elizabeth was saying, that you can go
Correct,
to.
yeah.
There are other
Yeah,
CVS.
wellness center, turning-
Yep, and yeah, I think it would be important not to look at it as a separate program, but a member of the treatment team.
Okay, thank you.
We can't hear you, Michael.
Thank you very much, thank you very much, Elizabeth, for that informative and insightful presentation. Appreciate all your passion and dedication in this area, so thank you. Moving on to item 14A, the needs assessment. EvalCore has begun meeting with the executive committee. I believe there's a few people have already met with EvalCore, and I'm scheduled to meet with them next week. And then from there, they're going to continue to broaden out as far as who they're contacting regarding the independent needs assessment. And so those of you who have, Elizabeth Stone sounds like she's met with them. And Chris, have you met with them yet?
Yes, yes.
It was actually,
how-
it's a Zoom interview, so it's not like meet, but yeah.
I also did an interview with them.
Okay,
And I have one coming up, one scheduled, Michael.
okay, excellent. I know I'm scheduled next week as well. So they're going to continue to kind of like widen the net as they continue to work through this needs assessment. Any questions? Janice?
Sorry, I'm having a problem raising my hand here. The prompt's not on my computer.
It-
I just wanted to mention that Marlon Torres did confirm that the meeting is on the 7th of March at 4:30.
Okay, thank you.
Meeting. Thank you.
Okay, any other any questions regarding the needs assessment? Public comment? I'm not seeing any hands, and I'm presuming no hands inside the room.
No
All right, moving on to B, site visit resumption. So we've gone through the protocol. We decided we were going to continue to use the protocol that's presently in place. And so the task of today regarding this was just to announce that we're going to move forward with site visits under our existing protocol and to send your request for site visits. And then the forms should have been sent out with this packet. And if you need the forms to be sent to you again, please contact me and or Jackie. Any questions or comments?
Yes, one in the room, Elizabeth Stone.
Sure, Elizabeth.
Okay, thanks. So I think what we agreed is that if we wanted to set up a visit to kind of announce it now to see if there's other members who'd like to join us. Is that correct?
You can if you wish,
Okay.
or
I'd
at
very
subsequent
much-
meetings.
Yeah, I'd very much like to, and I'm not even sure what it's called. I think it's called the CRT, kind of the step down from the IPU. So it's the
Yeah.
CRT, is that what it is?
Yeah.
I'd very much like to, and I don't even know the name because,
Crisis
that's the right
residential
name.
treatment.
sorry,
Crisis residential treatment center.
that's the name of a treatment type, but does it have a name?
CRG.
It's just called
It's just,
CRT.
yeah, it's just an
Okay.
address.
So anyway, so I'd like to visit that, so I'd like to arrange that, so if there's one or two, I think up to two, we set up to 3 people. 4 people, haven't had a however. There's other people that would like to join with me, please email me, elizabeth.s.bhab@yahoo.com. And then we can kind of hold a little group session and we'll get a visit organized.
And the site visits are limited to BHAB members only, because we have to be mindful as far as our footprint when we go to these sites.
Okay, so what I'm seeing is Chris and Jennifer. Is there anyone else?
Oh,
No,
was-
something else?
yes.
Oh, okay. Jennifer, you're saying you'd like to visit that? Just not.
Yes, please. Yes, please.
Okay, is there anybody else? All right, so just kind of get back to me, please, and I'll work on putting that together. Thank you, Michael.
Thank you.
Thank you, Elizabeth.
Any other requests at this moment?
Chris
Yeah, this
does.
is Chris in the room.
Chris, yes.
Yeah, I'd like to make a request to visit the TIMU in the Ventura County Main Jail, as well as the JVCT, I think it is, the acronym. So I'd like to see those facilities, and we'd be happy to lead the group through there, put a group together if other people are interested in that.
I would be interested in that, Chris.
Oh, great, Nancy.
Me too.
I think everybody.
Nancy and Jim.
Me too.
And so was I. And hold on one moment. Hold on one moment. Sergeant Pusey has his hand up.
Yes, okay, good.
Hey, good afternoon. Yeah, I'll set something up with Chairman Rodriguez to tour that. If you guys can just get me a list of who would like to participate, I'll set that up.
Thank you.
Thank you.
If I could just add one more request, that if it's available, I think it'd be really great to see the safety rooms as well, if those are available, but I understand they may not be available.
No, we can definitely do that. It would be the ones that are going to be in our new health and programming unit over at Todd Road. So we can definitely give you guys a tour of those as well.
Okay. And
You go ahead.
oh, sorry. And just to clarify, are the ones in the main jail still in use then, or are those no longer in use?
They are in use still.
Okay. All right, thank you.
You're welcome.
But I think one of his concerns is that they're very possibly in use right now, and we need to protect folks' privacy. So that's why I think he's suggesting the Todd Road facility, which is yet to open, but you have an idea of what the safety rooms are going to look like.
Would they be the same, run the same, look the same?
They're going to be different, I believe, but Sergeant Pusey would have more information on that than I would.
They are the same. However, once that unit is open, it'll be different in how they're staffed. So our WellPath group will be more involved with individuals that are put in the safety cells. So it'll be a little different in how they're monitored, but the look is the same.
Thank you.
You're welcome.
Thank you.
Sorry, one last.
Sure.
Would that
Then Janice.
Sorry, would that constitute two different site visits then? Because the TIMU's at the main jail and then Todd Road's at another facility?
It would.
Okay. All right, thank you.
You're welcome.
Janice.
Thank you. So the process, as we've been directed from California Association of Behavioral Health Commissions and Boards, is that once the leads decide and they have their members that are going, then the first thing to do would be to call the facility manager or whoever and make an appointment, and also send them the form that we've been given. So that's the first step. Also, if we have a group going to the TIMU, it has to be less than a quorum, but we could take a group. I know that Sheriff Fryhoff, then Commander Fryhoff, invited the entire BHAB to go. But we have to make sure it's less than a quorum, according to the guidelines.
Correct.
That's it. Thank you.
Thank you. Any other questions or comments regarding this item? Moving on to new business, item 15A, Brown Act emergency allowances. Essentially, it would be more like a catch-up vote to just authorize hybrid meetings through the end of this month, which is only a couple more days, but we need to go. I've been told we need to go through it nonetheless. And so I would ask for a motion to continue to meet remotely or via hybrid for the remainder of February. And in March, we have to go live. So can I get a motion, please?
Second.
This is Claudia.
So Claudia made the motion, and who seconded?
No. Elizabeth made the motion and Claudia seconded it.
Okay. All right.
Chair Rodriguez, can I get clarification on what we're
Yes.
doing? Because my understanding is that beginning March 1 is when we all have to appear in person if we're if we're a board member at any of the meetings where we sit on a committee or we're part of that existing subcommittee or committee. But that it will still be hybrid. So we're not voting on hybrid right now because community stakeholders will be able to participate remotely. So I want to make sure we understand what we're voting on.
No, all this is to authorize, this should have been done last meeting and it wasn't. It
Okay.
was to authorize hybrid meetings until the end of February. And so this is only going to last essentially for another couple of days, but I believe there might be 1 or 2 meetings between now and then. And so it would just cover that. Beginning March 1st, they're in-person meetings for BHAB members.
Right.
So this motion only covers up until February 28th.
Beginning March 1st, though, the hybrid meetings will still exist for community participation.
Correct.
Okay, great. Thank you.
So with that said, are there any questions or comments as to the motion? All right, can we get a vote, please?
Yes. Claudia Armand,
Yes.
Soledad Barragan,
Yes.
Nancy Borchard,
Yes.
Kevin Clarisi,
We have a quorum.
okay, all right, myself, yes, Cheryl Heitman,
Yes.
CJ Keepy,
Yes.
Supervisor Lavere,
Yes.
Nomi Marufa,
Yes.
Jennifer Morrison,
Yes.
Pat Malavi,
Yes.
Elizabeth Stone,
Yes.
Chris Tejeda,
Yes.
and Chair Rodriguez.
And
Can't
audio
hear you.
cut out.
I believe, yes, and then I believe Liz Warren as well. I don't think you called.
Oh, yeah, you're right. I'm sorry, Liz. Yeah.
That's all right. Yes.
Okay, we definitely have a quorum and that motion is passed.
Thank you. Next item is B, annual report work group. This is an action item. So this would be the work group for the last this would be an annual report for the last fiscal year. So I'm asking for a motion to form the annual report work group, which will be in place for a limited time, for limited duration to complete the annual report. And the annual report is one of the things that we need to address, which hasn't been done in most recently anyways, is to address gaps in services. And so it'll be incumbent that we work with the committee heads as well.
Are you going to share that?
Are you talking about?
Yes, I'll chair it.
Sorry, what are you asking for, a motion to form this work group?
Yes.
Okay, I move that we form a temporary work group to create the annual report with Michael as chair.
I just want to interject, if it's going to be if it's just going to be for a short period of time, it should be an ad hoc committee.
Well, it's a work group.
Not a
Work groups
work
are,
group. Okay.
well, work groups are for a defined period of time and
That's what ad
for a
hoc-
defined purpose.
Yeah, but that's what an ad hoc is too. So I'm just giving you the option.
Okay, thank you. Can we get a second?
Second it, Jan.
And that was a second by Janice?
Yes.
All right. Any questions or comments?
It looks like CJ said something.
Oh, CJ?
I was going to second it. So I'll serve on the work group of the committee.
All right, let's thank you, CJ. So let's get any other questions or comments so we can get a vote, and then I'll be asking for volunteers. Presuming it passes. All right, not seeing any questions or comments. Can we get a vote, please?
Claudia Armand,
Yes.
Soledad Barragan. Soledad's still here?
Yes.
Okay, yes, she is. All right, Nancy Borchard,
Yes.
myself, yes, Cheryl Heitman,
Yes.
Jake Keaveney,
Yes.
Supervisor Lavere,
Yes.
Nomi Marufa,
Yes.
Jennifer Morrison,
Yes.
Christian Malavi,
Yes.
Elizabeth Stone.
Yes.
Chris Tejeda,
Yes.
Liz Warren,
Yeah.
and Chair Rodriguez.
Yes.
We have a quorum and the action item passes.
Excellent. And so, because I want to get to Liz. So for those of you who are interested in serving on this work group, please contact me. I'm putting you down, CJ, since you spoke up already, but I want to move through this. So please email me, michael.rodriguez@ventura.org, if you wish to volunteer on the annual report work group.
What's the
So-
timeline, Michael?
We're gonna start meeting within the next couple weeks, so, and then move forward.
When do you need it completed by?
That, let's get the work group going and then we'll address it at that point.
You know,
Thank you. So moving on to C, Ombudsman Work Group Report, Liz Warren.
So it's 3:36.
Yeah.
And I don't want to give this short shrift. I want to have a real legitimate discussion about this, Chair Rodriguez. And so you've allotted 20 minutes for me to talk about this. There's the attached documents that went out with the agenda. And I guess people have left the meeting at this point. And so I'm not quite sure the most prudent way to move forward in order to really have an effective conversation. I'm happy to do it, but I just want to be mindful of time.
I appreciate that. And if long as there's some relative consensus on this, because I do also want to place the importance or honor the importance that this issue has, is if you wish, we can put it, table it to next meeting and put it higher up on the agenda to ensure that we deal with it early on in the agenda so we can move forward.
Yes, could I, Ratan is on the work group with me. Ratan, could you, hi. Ratan, how does that sit with you? Is that okay with you? Okay, well, then I appreciate the offer. I think I would, as much as I wanted to be able to do this today, because I know that there's some time sensitive issues that are happening right now. I think that it would be a better way to go than if we could take your recommendation and move it to next general meeting and put it higher up on the agenda. I'd appreciate the accommodation.
Sure. And I apologize for not getting to you today. So we will do what we can to prioritize it next meeting, and we'll have it higher up on the agenda.
Thank you.
Thank you. So moving on to item D, I'm going to combine D and E regarding presentation and recognition, presentation requests and recognition award recommendations. Once again, please send them to me. And with respect to presentation requests, a brief description of the presentation, the subject matter, and who will be conducting it. With respect to the recognition award recommendations, the reason for the recognition. And I know Chris is still working, I believe Chris is still working on the recognition for Jerry Harris.
Yes, yes.
Chris, are you just waiting to get a date with Jerry, or are you still working on this?
I worked with, I think March will work with Jerry, so it's just working out schedules, and then also I know I sent out an email with a few of us, so hopefully we get together and define some of that language.
Thank you. All right, moving on to item 16, contracts. Board of Supervisors didn't approve, is my understanding that Board of Supervisors did not approve any irrelevant contracts during this last period. But I know there's others coming up, or I believe there's others coming up. Any questions as to that? All right, moving on to item 17, public comments. Any public comments?
Janice?
Janice.
Are there any public comments before I send my comment? No? Okay, I wanted to thank Elizabeth for her report today. It's very comprehensive. a lot of great information, and I just want to say thank you.
Thank you. I wish you got to see the whole thing.
We will.
Yes, well, we got it.
We got it.
Thank you, Janice.
All right, Jennifer Morrison.
When we run late like this, is there a chance that we can check in with the whole board when we get to be like 3:30 to see if we should adjourn and push all the remaining items to the next meeting? Because I think it's important for people to be present. And I don't know, I'm just concerned that people are missing important things, you know? And we want to be mindful for everybody's time, you know?
Agreed. And and I appreciate that, Jennifer. And one of the things, the balancing act of running, especially this meeting, is giving people space so that they can be heard. And giving as many people space so that they can be heard. And then moving the meetings along. And I haven't been able to kind of like strike that appropriate balance, because I really genuinely believe that each and every board member should have an opportunity to be heard and express themselves and provide their insight and their perspectives, and as well as members of the public. And so it's a balancing test that I'm still trying to figure out and balance. So, but I do
No,
agree
I don't think you're not doing a good job. I just think that if we're coming up to 3:30, that perhaps we can check in with the board and say, hey, do we want to push the remaining items to the next meeting so that everyone can be present? Because you don't know who's dropped off and who hasn't, you know what I mean?
Agreed.
Actually, there's only one member that has left the meeting that wasn't here initially. Just letting you know.
Okay.
All here.
Well, that's not just pertaining to this meeting, it's any meeting, you know? Because you don't know how long we're gonna be going.
And I would just say that the concern I have isn't just to make sure we have a quorum. If it's an action item, that's important. And to make sure that board members are continuing to be present throughout the duration of the meeting, but we have community stakeholders and they have to jump off. We have VCBH staff, they have to jump off. And so people that I think need to hear a lot of what we're discussing suddenly are no longer part of this process. We're all just talking to ourselves. And I don't mean that disrespectfully. I think part of the problem, and I know that Chair Rodriguez has worked on this, is that our agendas were getting like really out of control. Like we were like really large and huge. I think one of the things that happened today, because we had a lot of committee reports, it just takes up time. And when we know that we're going to be having, you know, larger chunks of those kinds of things being discussed, then we perhaps can pull back on other things. This is all hindsight. I am not trying to quarterback this, but I just think that we've done a good job overall of trimming the agenda, because it used to be multiple presentations. I mean, it was getting a little out of hand. One thing that we stopped doing that maybe we want to reconsider as a group, especially when we get back in live person, is, you know, when we used to time speakers. We used to say, okay, you got 2 minutes left, and we haven't done that in a long time. So we might want to get back to having a clock so that people understand the amount of time that they're using, that they've been allotted. That might help, you know, reel some folks in. So just a thought.
Just a reminder, that clock was used to make sure that individuals who were not official members were not allowed to speak more than 5 minutes over the entire meeting.
Except that Chair Rodriguez said that if they needed to, he would accommodate that.
Right,
Because
okay.
he
So
was
he's
open to
thrown that out
discussion.
because that was instituted just willy-nilly by Jerry, but that's what the clock was used for at that time.
Right, but then it was modified. So I'm just trying to think of ways we can help to, I don't know, keep, you know, to Jennifer's point, keep us, you know, we're like, we need an air traffic controller. There's a lot going on.
Right.
Yeah.
I don't feel good just dropping off a call. I mean, I
don't
also
either.
work. I also have a, you know, I'm working and I
Yeah.
need to be respectful to my other appointments, but I don't feel good just dropping off a call right in the middle of a conversation because it's 3:30. So I just would think it would be more appropriate if we could just kind of have a check-in at 3:30. And if there's a lot of items left, perhaps push to the next meeting.
Yeah, I mean, at 3:15, we know we have 15 minutes left. Let's take a look and see what we want, how we
Right.
want to wrap it up. But yeah, I agree. I
Exactly.
think that's a good way of going. I'm open to anything.
Okay, thank you. Appreciate that, Jennifer.
Thank you, Michael.
Anything else? All right, thank you, everybody, for your patience and your participation and your perspectives and insight. And meeting is adjourned at 3:45. Thank you and be well. Bye.
Thanks, Michael, you too.
Thank you.